Hello everybody. My name is William Huang, and I'm a rising senior at Palos Verdes Peninsula High School, located in California. And my talk today is about combating the global vision loss crises through retinal prostheses. So a bit about me, like I said, I'm a rising senior, so I'm in the class of 2023. In school, I'm heavily involved in Science Olympiad and Stellar Explorers, as well as our science research class. I've been doing research for about 4 years now, and I've gone to the International Science and Engineering Fair. I'm also an avid volunteer. I started a nonprofit during the pandemic where we 3D printed PPE for frontline workers, and I've also been involved in civic engagement through working with organizations like the Leukemia and Lymphoma Society, where I work to fundraise money for cancer and blood cancer research. Finally, I play piano. I'm the piano accompanist of two community orchestras and was invited to perform at Carnegie Hall this past year. So now a bit about my research. To place this research in a global health context, I'd like to begin with some jarring statistics. So according to the World Health Organization, 2.2 billion people worldwide suffer from near or distance vision impairment, and that's approximately 30% of people globally. Additionally, according to the Bright Focus Foundation, one source of this impairment, age-related macular degeneration, is responsible for $343 billion in global costs, which is only a fraction of the $3 trillion resulting from vision loss worldwide. And this is devastating for blind people, especially in areas with a lack of resources like developing countries. And with the onset of the coronavirus pandemic, an estimated 50 to 70% increase in internet use, this problem will only be exacerbated. Therefore, the questions of what are retinal degenerative diseases and how do we solve this problem naturally arises. So I'll first begin by addressing the first question. So retinal degenerative diseases are progressive neurologic disorders caused by pathologic damage to the retina, affecting over 200 million people worldwide each year. Currently, there are no effective treatments or cures to reverse the effects of these diseases, and therefore doctors can only prescribe medication to reduce the swelling or recommend the use of sunglasses. Furthermore, state-of-the-art treatments on a molecular level through CRISPR-Cas9 editing of RPE65 gene mutations are still preliminary. So how do we solve this problem? This is where retinal prostheses comes in. Retinal prostheses are bioelectric implants that provide patients with visual percepts through electrical stimulation. And these devices have revolutionized this space as the Argus 2 became the world's first FDA-approved technology capable of vision restoration. They basically consist of three main components: a camera, which captures images that are sent to a processing unit, which then convert this visual information into electrical stimulation parameters, which are then sent to a chip on the eye that stimulates the retina and allows the patients to see. However, there are a few key problems. The first is the low image resolution that the patients will see, and this is because of the compact environment on the retina that the array needs to be placed in, and therefore they're limited to 20 to 2,000 electrodes. The second is the lack of color, which along with the low resolution makes it extremely hard for patients to recognize objects. Third is adaptability. Patients, especially first-time users, face a steep learning curve to identify objects. Now, to help patients see better, there are mainly two strategies. The first is simply downsampling the whole image, which is what the current Argus 2 prosthesis does. However, this strategy indiscriminately reduces information in all areas of the image, including important objects. The second is edge detection, which tries to address this approach by highlighting objects in contrast to their background. These two strategies still do not address the issue of color, and the resolution of sending objects needs to be further improved. Basically, what this means is that patients see colorless images and are often not able to identify the main objects in their surroundings. And this is what my research essentially tackles. So my research accomplishes three goals. First, I magnify and improve the resolution of main objects through a virtual magnifier. Second, I encode the maximum amount of spatial and color information through an image optimization framework. And third, I augment these optimized images to help patients quickly adapt to these processes through an autoencoder. So I'll hold off on the methodological details today, They are rather technical, but if you're curious, feel free to reach out to me. I'll provide my contact information at the end of the presentation. So now I'll present what I found in the 3 parts of my research, beginning with the virtual magnifier. So in total, I evaluated my algorithm on 5 different tests, ranging from accuracy to scalability. And what I was able to see from these tests is that, in contrast to traditional zoom in and segmentation algorithms, the magnifier maintains information from the entire image, which is important for patients to gain a general sense of their surroundings. It also reduces the problem that current salient object detection algorithms face in images with many objects, as it allows me to first focus in on a specified region, as we can see in the example images on the left. So similar to the magnifier, the optimization framework performed very well. Over here on the left, we can see that the region contrast sensing maps outperforms maps created by other studies. And on the right, I'll present the effectiveness of my color quantization algorithm. And finally, we can see the difference between the output of my framework versus the output of the current Argus 2 processes, as seen on the bottom right. So now I present the results of my autoencoder image library. I was able to train the model on 6 different data sets, ranging from human faces to cars. And to make it easier for doctors to access my library, I created an interface using Python. And to test these frameworks' applicability in the real world, I did a prototype system, and as we can see here on the right, it successfully highlights the salient objects while retaining the color. So what are the conclusions of this study? First of all, we demonstrated a new magnification tool to help patients focus on main objects. We also provide patients with an optimized vision, specifically by encoding color into their visual perception. Finally, research initiates the idea to provide future prostheses users an easily accessible image library of optimized images for patient training. And with this framework, I hope to move one step closer to solving the global vision loss crises. So here are some of my references, and this is my contact information. If you have any questions or concerns, feel free to reach out to my email or my LinkedIn. And thank you so much.